Hello and welcome to Cooee. My name's Marion and I'm the owner and director of the Cooee Speech Clinic. This video is a short introduction that's outlining what you can expect as you have your first few appointments with the Cooee team. In this video, I'm going to talk about 4 important topics. We're going to talk about what we do at our clinic, what the first session is all about, the assessment and goal setting phase that you'll be stepping into, and how we run cycles of therapy and review. Let's go. So we have speechies and OTs working in the Cooee Clinic. We also run student clinics and have student clinicians from local universities at various times throughout the year to help our families. Because we have both speech and OT, there are 3 ways that you might engage in therapy at Cooee. You might do single discipline therapy, multidisciplinary therapy, or even interdisciplinary therapy. In single discipline, what this means is you'll see the speechie or the OT on their own in your sessions. In multidisciplinary therapy, you might do speech on their own or OT on its own, and you'll be doing both of those things simultaneously. Sometimes it might even happen in a joint session, but you'll be working on separate goals with both of those therapists. In interdisciplinary therapy, this model is for clients who cannot access single or multidisciplinary therapy because of the level of their clinical needs. So the therapists work together in joint sessions on a joint goal. If you're accessing multidisciplinary or interdisciplinary sessions, then your therapist will always recommend what kind of meetings, the frequency of reviews or updates that are needed for the team to coordinate the service. These additional indirect services are charged at our hourly rate, and you'll get a quote prior to receiving them. So that's a bit about the clinic as a whole very quickly. And now I want to share with you what it looks like to start your child's therapy at Cooee. The first thing we start with is a client journey planning session. And the aim of this session is to collect information from you, with the parents being alone in this session with a therapist. That's so you can discuss your concerns openly, and the therapist can share with you information required for you to move forward. So sometimes this might look like education about a particular diagnostic area or information about the assessment phase. They'll also be collecting case history information. In this session, your therapist will recommend what the assessment and goal setting phase needs to look like. This is different for everybody depending on what you need and the services you've accessed already. Finally, once that assessment and goal setting phase is complete and the plan is clear, families move into cycles of therapy and review in line with your management plan. So let's jump in and just have a look at each phase a little more closely. The client journey planning session. These are the first sessions you'll have with us. We individualize this appointment and the appointments that you need upcoming based on your child's needs. In this session, we aim to gather the referral information and your primary outcome, what's bringing you to therapy. The clinician will take a comprehensive case history, they'll ask you lots of questions, and begin to develop the clinical hypothesis to understand what are we exploring with you. We want to take time to understand your family background and culture, know who your key stakeholders are, other people as part of your community that might be involved in the therapy journey, and understand the meaningful environments that your child participates in, and ask questions about how they participate in those environments. We intentionally aim to run this session without the child present so that you can discuss your concerns and your therapist can provide you information without your child overhearing you talk about areas of concern in front of them. This session is booked for 60 minutes, but it may take less time depending on what you need, what you already know, and whether you have reports and assessment data already. At the end of this session, we aim to have the assessment and goal setting phase clearly outlined and quoted for you and all booked in so you know the plan about how we're going to begin the exploration in line with that clinical hypothesis. That exploration might be long or it might be short. So now we step into that goal setting and assessment phase, and this phase varies significantly amongst children. This is why that clinical journey planning session collects your information and outlines what this is going to look like for you. We have robust clinical protocols at Cooee that are based on the latest evidence, and this is how we set our recommendations. The assessment phase is important, and we know it's completed when we have a clear picture of what's going on for your child and have some clearly identified goals to work on. The assessment phase may include some or all of what you can see on the screen at the moment, but it's important to have a beginning starting place to know where we're setting our goals from. This may include some standardized assessments or tests. It might include dynamic or informal observations and assessment. We will need to gather some baseline data, regardless of what testing has been done, to know where we're starting therapy right now so we can measure our outcomes. As mentioned, we will use our assessment protocols to make recommendations around what is needed, and then at the end of that assessment phase, discuss and set collaborative goals with you. We want to know what the long-term goal is. We will want to know what's the short-term goal, that first step towards it. And the clinicians will then set a management plan related to the goals that are going to be worked on in those sessions towards those short and long-term goals. We want you to have informed consent around the primary intervention options that are available for you and to have a chance to discuss the expected length of the treatment phase as well. This should all be outlined in a written management plan that's simple but clear prior to starting therapy, so you know exactly what you're working on and how we will measure whether or not the therapy is right for you. The cycles of therapy and review then begin, so the management plan will outline what your first cycle of therapy is going to look like. You then attend the sessions in the management plan and work with the therapist to help achieve outcomes for your child. This will include any number of things that you can see on the screen here. So delivering intervention in therapy, measuring outcomes, providing adjustments or scaffolds or individualization to help it work for your child. The clinicians will then bring in review for you to review the outcomes on the defined date. So that might be after 6 sessions or after 10 sessions, depending on what's been agreed on at the start. As you complete one cycle of therapy and you discuss the outcomes that have been achieved and where you want to go, there will then be a next management plan set for the upcoming phase. Your therapist will collaborate with your team and the stakeholders that are important to you, and when those short-term goals are all met or the long-term goal is achieved, reassessment might be required to determine where are we going next in our intervention. At the end of each cycle, meetings with other team members are called case conferences, or clinical planning sessions will need to occur before the next management plan cycle begins. This cycle is important so that we're ensuring we're building in reflection and pause, and we're accurately measuring the response to the intervention that's being provided. The rhythm of these meetings will be discussed with you in your assessment phase, so you know the plan, the fees involved, and why each step is important. When the plan is reviewed, if the assessment profile is still valid, new goals get made. If reassessment's needed, then this would be recommended, and then you'll return back into the assessment and goal setting phase before you continue therapy. Thanks for taking the time today to understand the steps involved. We look forward to meeting with you soon, and we're really excited to help your family reach meaningful goals in your therapy process.